The last portion of Chapter 5, our discussion of the skin, concerns skin diseases and also wounds and wound healing. One common skin disorder or disease is skin cancer. It is induced by the UV rays of the sun, and there's a few different types. The least dangerous type is basal cell carcinoma. This type of skin cancer arises from the stratum basale and invades the dermis. So it basically starts at the deepest layer of the epidermis and will grow into the dermis. It generally stays fairly contained to the location that it is in and is fairly easy to remove, especially if it's caught early, because that portion can just be cut out. Squamous cell carcinoma is slightly more serious. It arises from the keratinocytes in the stratum spinosum. So that's the second layer, and those are those little spiky cells. At that point, the keratinocytes should not be dividing. They should have already done all of their dividing in the stratum basale, and they should not be dividing when they're in the stratum spinosum. So these cells are dividing abnormally. This type of skin cancer can metastasize, which basically means travel to other parts of the body. And if it goes to the lymph nodes, then it pretty much is going to go throughout the body, and that can be lethal. The most deadly form of skin cancer is malignant melanoma. So it's the most deadly, and it arises from the melanocytes, the color-producing cells of a pre-existing mole. And the things you want to watch for are the ABCDs. So A stands for asymmetry. Is the mole equal on both sides, or is it asymmetrical? B stands for border irregularity. So if the border is not smooth, then that could indicate that it might be a malignant melanoma. C is for color. If the mole is more than one shade of brown, so if it has darker spots and lighter parts, that indicates it may be a malignant melanoma. And finally, D is for diameter. If the diameter of a mole is over 6 millimeters, that's about the diameter of the eraser of a pencil, then you should definitely get it checked out. So if any of these things apply to a mole that you have, I would encourage you to make sure that a dermatologist checks it out and makes sure that it's not looking like a malignant melanoma. Malignant melanoma can be the result of an oncogene. An oncogene is a gene that predisposes you to a certain type or types of cancers. So the oncogene BRAF in men, if you have that variation of the gene, you are more likely to get malignant melanoma. Burns are another issue that affects the skin. So burns can be caused by a number of different things. They can be caused by excessive heat, such as hot water. They can be caused by sunlight, radiation, electric shock, and acids and bases. So if you have a corrosive chemical, you can get a chemical burn. Generally, death is going to result from fluid loss and infection. So two of the main functions of skin are to be a waterproof layer so that the water inside of our body doesn't all evaporate, and to protect the body from infection. So without an intact layer of skin, we tend to lose excessive fluid. Basically, we dry out, and we are much more prone to infection. Treatment for burns includes IV nutrition and fluid replacement, so basically replacing the fluid that is evaporating out of you. Debridement. Debridement is an uncomfortable process where they basically scrub out the burn, so it's helping to prevent infection. And then generally some sort of protection as far as isolation, bandaging, or antibiotics to make sure that any infectious organisms are controlled. So there are 3 degrees of burns. You may have heard of a 1st-degree burn, 2nd-degree burn. Burns are named based on how many layers of the skin they affect. So in a 1st-degree burn, only the epidermis is damaged. These can be red and painful and have a little bit of swelling. This is most sunburns. So if you get a little red from the sun, you get a little red, might be a little uncomfortable, but only the epidermis is affected. So here you can see the diagram where only the epidermis is damaged. The dermis is still fully intact. A 2nd-degree burn, like is seen here in this child's hand, the epidermis and part of the dermis is going to be damaged. So we're going to go through the epidermis into the dermis. So that's 2 layers of skin. When you have a 2nd-degree burn, this is when you start getting blistering. So if you grab a hot pan, oftentimes you'll get a 2nd-degree burn. The epidermis is going to regenerate from the hair follicles and the sweat glands. So there's epidermal cells that are hiding within the hair follicles and sweat glands. And so when the epidermis is burned off, these epidermal cells that line the epithelium in these 2 glands, they're going to reproduce and start basically crawling out and covering up all of this surface and creating a new epidermis. 3rd-degree burns are the most serious of burns, and you can see a 3rd-degree burn here where you have skin peeling off and you can see some of the underlying structures underneath this burn. This is when the burn damages the epidermis. It goes through all of the dermis and into the subcutaneous layer or hypodermis. So these burns could go as deep as the muscle or bone depending on where they're located. In this situation, the situation of a 3rd-degree burn, we have destroyed all of our hair follicles and sweat glands in that area. So we have no epithelial cells in the area to regenerate our epidermis. So these 3rd-degree burns often require grafts, basically where they take a piece of skin from one part of your body and put it on the damaged part of the body. And these are much more likely to cause scarring, which is fibrosis, and disfigurement with a 3rd-degree burn. When we're calculating how much of the body is burned, we use a rule called the rule of 9s. So we use this to estimate the surface area that's burned. So if we burn one whole entire arm, both the front and the back, that is going to be 9% of our body. So it's 4.5% for the front, 4.5% for the back. Now our legs are a little bit bigger than our arms. So our legs, each leg is 18% of our body's surface area. So if you burn the whole front of the leg, it's going to be 9%. The anterior trunk is 18%. The posterior trunk is also 18%. And the front and the back of the head are 4.5% each, or 9% total. So the head is 9%. Each arm is 9%. The trunk is 18%, so 2 times 9. Each leg is 9, and that's where we get our rule of 9. So when you hear that someone has burns to 20% of their body, they're using these estimates to determine approximately what 20% is. Oftentimes, 3rd-degree burns require skin grafts. There are a few options for skin grafts. And these are sort of interesting in terms of what can be done and where they come from. So an autograft is tissue from the patient. So sometimes they'll just cut out a small portion of tissue, let that wound that they've just caused heal itself, and then they will place the piece of removed tissue onto the burned area. Sometimes they will also culture the cells that are in the patient's skin and basically grow them new skin. The downside to growing the patient new skin from their own cells is that they have to be without skin while those new cells are growing. So they have to be protected while the new skin is in the lab growing. An isograft is tissue from an identical twin. So if you happen to have an identical twin, you are eligible for this procedure. I don't have an identical twin, so I would never be able to get an isograft. We also have some temporary graft options. These are temporary because the immune system will detect that that is not part of your body and then reject the graft. However, in the period of time where you're waiting for your keratinocyte patch to grow up in the lab, or if there's a large area which is burned and it needs to be protected, sometimes temporary grafts are used. A homograft is from an unrelated person, but it's still from a human. A heterograft is from another species. So sometimes they'll take pig skin and use that to help protect someone as they're waiting for their skin to heal or waiting for a cultured keratinocyte patch. You can also use the amnion from the afterbirth. It's a certain part of the afterbirth. You can use that to create a temporary graft. And they create artificial skin from silicone and collagen. So it's basically a framework and protective layer that is a temporary covering for your skin. Tissue repair includes regeneration and fibrosis. So these are two options that can happen when tissue is damaged and has to be repaired. The body can either regenerate tissue, which involves replacement of the damaged cells with cells that are exactly like the original cells. Things like skin injuries, so scrapes, cuts, and also injuries to the liver can regenerate. So not all of our tissue is able to regenerate, but our skin and our liver are two tissues that can regenerate. Fibrosis is when we replace the damaged cells with scar tissue. If we replace the damaged cells with scar tissue, the function of these cells is not restored. So if you have a very bad muscle pull, that muscle will heal and it will work still, but you will always have a portion of the muscle where the muscle cells don't have sarcomeres and contractile elements. Another example is scarring of lung tissue in patients with tuberculosis, or healing of very severe cuts and burns of the skin. So if you have a 3rd-degree burn, you'll likely have a scar, and that's going to be fibrosis. A keloid is healing with excessive fibrosis. So instead of just scarring where the old tissue was, the fibrosis, the scar tissue, tends to be raised and shiny. And that raised, shiny scar is called a keloid. Some individuals are prone to getting keloids, whereas others do not get them. There are two types of wound healing that we're going to discuss. When we have a superficial wound that only affects the epidermis, the first layer of our skin, we have epidermal wound healing. These wounds generally do not cause any scarring because none of the connective tissue has been damaged. It is simply the epidermis. This is what happens when you just scrape your knuckle and just take off that first layer of skin, and the epidermal cells are going to be able to grow back and heal that wound. In contrast, deep wound healing is when the injury extends into the dermis and the subcutaneous layer. So if you cut your finger with a kitchen knife, it's probably going to be a deep wound. So when we have a deep wound, in this case a laceration, deep wound, we're going to have a number of different phases that occur in the healing process. It's going to be more complex than just having those epidermal cells grow back together. So the first phase in the healing of a deep wound is going to be the inflammatory phase. In the inflammatory phase, our damaged vessels, so for instance, if we have damaged this blood vessel, if it was a little bit deeper and we damaged it, or if it was a little over to the side and we damaged one of these blood vessels, these vessels are going to leak blood. So you're going to bleed. The damaged cells in this area, all these cells along either side have been damaged, they are going to leak a chemical called histamine. So this is an inflammatory chemical, these little blue dots. They're going to leak out from the wound area, and these histamines are going to dilate blood vessels. They're going to make the blood vessels bigger. They're going to increase blood flow and increase the permeability of these capillaries. So all of these things are going to result in more bleeding. Bleeding is actually a helpful thing initially, because if there's any dirt or bacteria or other pathogens that got into this wound, if we bleed, it will push all those things out of the body. So one of the things that happens in the inflammatory phase is we bleed, and we have these things that happen that increase our bleeding temporarily. As we bleed and as more blood comes to the area, the plasma that's in the blood carries antibodies, so things that are going to look for viruses and bacteria and fend them off. It carries clotting factors to help the blood clot inside the wound. And it carries these white blood cells. So these white blood cells are going to migrate into the tissue, and they're going to start basically cleaning up all of the damage. So all of the damaged cells and any pathogens that are in the area. The last part of the inflammatory phase is when we have a clot. So this blood clot is the last portion of the inflammatory phase. The next phase of deep wound healing is the migratory phase. We have a scab that's on the surface. We have macrophages and white blood cells that are cleaning up the debris. These guys are like garbage men. They're just cleaning everything up that's damaged. And in this phase, the epithelial cells in the stratum basale migrate towards each other. So we're forming a new base layer of our epithelial cells in our epidermis. As these cells replicate, they're going to push the other cells up and eventually push the scab off. So the proliferative phase is that phase when these epithelial cells are regrowing and reforming the epidermis. In this proliferative phase, so proliferation means growth, new capillaries are going to grow into the wound. So basically new blood vessels are going to grow into this previously wounded area. Our fibroblasts, remember those are connective tissue cells, are going to deposit new collagen in this area to hold the wound together. This proliferative phase begins about 3 to 4 days after the wound occurs and lasts up to 2 weeks. Our final phase is the maturation phase or regeneration. In this phase, our tissue is returning to normal. Our scab has fallen off. Our epithelium, our epidermis, is thickening. And our connective tissue is scarring. So connective tissue is unable to regenerate. It is only able to produce scar tissue or fibrosis. So although on the surface you may have regenerated epithelium that looks just like all your other skin, underneath there is scar tissue. And this remodeling phase may last up to 2 years, depending on the severity of the wound. The last thing we'll talk about is aging. The integumentary system, our skin, changes with age. And unfortunately, none of these things are particularly positive. So we develop wrinkles. Our skin gets more dehydrated, and tends to crack more often. Our sweat production decreases, so that has implications not only for our skin and the flexibility and moistness of our skin, but also for cooling. We're not as good at evaporative cooling. We have a decrease in the number of functional melanocytes. Remember, those are the ones that produce color. And this is what results in gray hair, and sometimes in older individuals you will have atypical, not normal, skin pigmentation, so they'll have light spots. Our subcutaneous fat is lost, which initially may sound good, but that means that our skin is less thick, there's less of a protective layer there for us, and we have less cushion to protect our body. Nails oftentimes become more brittle, and our number of active hair follicles declines. So less hair follicles are active, so our hair grows more slowly. And that concludes our discussion of the integumentary system.